The impact of the Depression was far-reaching. First of all, on poverty and diet. When you were on the dole, you would get on average about £1.46. £1.46 a week. On the dole. Now, if you imagine, I think we mentioned in the previous tutorial, it would be about £3, the average wage in Britain in the mid-1930s. So it was about half of that. Now, if you imagine within that £1.46, you have to pay for rent, coal, gas, perhaps meat, milk, bread, margarine, jam, and shoes. Once you've done all of that, and clothes, once you've done all of that, you have very, very little left. And this led to many cases of malnutrition, especially for children, who would not be fed things like vegetables, milk, fresh fruit, meat, things that we perhaps take for granted now. They would not get much of at all back then. Very famously in 1936, this is the dole, by the way, over here. In 1936, there was a survey published of people's health in Britain, and at the end of the survey, they basically said that the result was that 4.5 million people had a diet that was completely inadequate, which is a lot of people. You know, that's a lot of people with a diet. 4.5 million with inadequate diet. So it's really, really difficult for them, and it's very difficult for them to make ends meet and to feed their families. The most common things they would be fed is a staple diet of bread, margarine, potato, sugar, and tea. But but ultimately this is not a mixed diet. It's not, particularly for children, it's not a healthy one. And one of the offshoots of this, of course, was that mothers would sacrifice themselves for the children. And there were cases where mothers died because they basically starved themselves to death, so the child could have a decent meal on a regular basis. So poverty and diet, massive impact on that. Also, big impact on women as well. Many women lost their jobs first due to the Depression, due to, I suppose, sexism. You'd really have to class it as now, but many women lost their jobs first. Massive unemployment for women. A lot of them, by the end of the 1930s, ended up going into the domestic service, which is like working in the homes of the rich. It was a job that many women didn't like, but by the end of the 1930s, many of them didn't really feel they had a choice. Also, that in a family unit, national insurance covered the worker. So national insurance covered the worker and not necessarily the woman and child, which meant that the man was covered for his medical treatments, but the women and the children had to actually pay for that treatment in many cases. So that meant that the death rate for women was actually much higher than it was for men. So national insurance only for the worker, which most of the time was the man. So as we mentioned, that had a knock-on effect. Another big impact was on health and housing. So one of the consequences of poverty and poor diet was the higher infant mortality rate. I think we mentioned earlier about the fact that lots of children were dying due to ill health. For example, in the 1930s, for every 3 children from richer families who died young, there were 8 children from poorer families. So 3 children die from rich families, whereas 8 children die from poor families. And we're talking about children who die young here, who die young. So you can see there's a massive difference here. There's a massive difference between 3 and 8. And there wasn't this attitude that we perhaps have now in Britain, that everybody deserves that equal right and opportunity. Back in the 30s, it was very different to that, as you can see from those statistics. Housing, very, very similar. 12%, this is 1935 now, 12% of the people of Britain lived at least 2 to a room. 12% 2 to a room. Many people lived in vastly overcrowded homes. London, it was very common for a family to share a room in a flat, and it might be that a big housing block might have 10 families living in it in London, but I suppose London would be your worst example of the lot due to the fact it's overcrowded anyway. Psychological effects, there were many, but the big one would be guilt. Men would feel very guilty about the fact that they're supposed to be the breadwinner. That was the overriding feeling, I think, during that time. And they lost all their self-respect and confidence and self-esteem. It almost got harder to get a job the longer the time went on. Now, it would be up to you, really, which one of these you think is most significant or the biggest impact from the Depression, or all 4 of them have their own merits in terms of how the knock-on effects and the impact on the social fabric of the country. But it would be up to you, really, to decide which one you think was most significant.